Do you ever have trouble communicating with patients, really unsure exactly how to speak with them? Today I'm going to talk a little bit about Atal Gawande and some of his thought process. Atal Gawande, who some of you may know, wrote this book, The Checklist Manifesto, which is basically a Bible for all medical professionals. It's having a checklist for everything that we do. But what he's not as well known for is this book is called Being Mortal. And what he writes about in this book is end-of-the-life experiences. He talks about how do you make a decision at the end of someone's life, and how are doctors trained or not trained to have that conversation. In the book, he talks about his own father who died of cancer, but when he was sick, his father was also a physician. He pretty much got caught up in the medical vortex and got sicker and sicker, and the medical care that he got didn't make him that much better. And in fact, the same thing happened to me and my mom, and I'll talk to you about in a second. Well, he talks about, in this book, the 3 different ways that a doctor can communicate with a patient. Let me talk about the first one. It's called paternalistic, where the doctor is the parent and the patient is the child, and the parent tells the child what to do. Now, that only works for a few years with a child, as some of you may know who have children. Kids might listen to you when they're 3, 4, 5, but when they get up to be a teenager, they're going to start to push back a little bit. You know, if a kid is like 4 years old, they go, I want ice cream for dinner. You go, well, you can have ice cream after dinner. You know, you can do the parent thing, say, yeah, we'll give you ice cream after dinner, but now you have to sit down and have dinner. And, but with patients, that doesn't work anymore. Especially now with social media, people and Google, people will go online and they'll figure out what to do. They don't really listen to the doctors. They don't treat the doctors with as much respect. They don't treat anybody as an all-knowing power, especially in the United States. Everybody's very independent. But when I was younger, and a younger doctor, when I would treat World War II veterans and people of that ilk, my father's generation, I would tell them what to do, and they go, yes, doctor, no, doctor. They would listen to me. But today, that relationship doesn't exist. What happens today is mostly a retail relationship, the informative relationship, where you give the patient choices. Well, we could take out the tooth and do an implant, or we could do a root canal. What do you want to do? This is, $10,000. This is $7,000, or, whatever price that there is. And then the patient makes a decision. The problem with that is the patient doesn't usually have all of the information to make a decision. And that's what Atal Gawande talks about in this book, because at the end of your life, when you have to make a decision of whether you do chemotherapy or whether you're hospitalized or stay at home, or how do you end up dying when there's no really good solution for you, we don't always tell the patient about that. As a matter of fact, in my own life, my mom died of cancer. My mom had lung cancer, and then it metastasized to the brain. And her life expectancy was less than probably 4 months. And the doctors came to the house, and she was living with my dad at the time, who was healthy. And my dad was sort of managing care. And I knew that her life expectancy was 3 to 6 months. I knew the chemotherapy would not save her life. I also know it would lead to the loss of her hair and take away her mobility and make her very weak. But my dad wanted to do what the doctor said, do anything possible to try to save her life. So she had chemotherapy, and she was dead within about 3 weeks. She ended up having an emboli, and it went to her lung, and she stroked out. And the last 3 or 4 weeks of her life were terrible. She wasn't told that she was going to lose her hair. She wasn't told that she was going to be weak. She wasn't told that it was not going to extend her life. Maybe it would extend the life by a few months, but the quality wouldn't be there. Now, we as dentists, we don't usually talk about life or death, so we usually don't have those deep, heavy conversations. And physicians, unfortunately, are never taught to have those conversations with patients because they are in the informative type of care. They will tell patients what the procedures are. You can do this, this, and this. They don't always give them all the information. They may not have all the information. They may not be conversant with that kind of conversation. But I think it's very important that doctors are. So they talk about all the consequences. Now, example, something very simple. You go to a restaurant. If you just eat dessert and you don't have any protein or any vegetables, your digestion's not going to be good. Your caloric intake is going to be increased. You're going to have like a sugar rush, and then you're going to bonk. All that kind of stuff. If you eat a dozen donuts for dinner every night and don't eat healthy, you're going to put on weight. And if you're diabetic, you're not going to be able to control your sugar. We know that. But we don't know. What we don't know is all the nuances of what we do in our offices. Our offices to patients are scary. I always use the analogy, like we're like the Wizard of Oz. Dorothy and Toto and the Tin Man, the Lion, the Scarecrow, they're walking to the Wizard of Oz. They think there's a wizard back there. Patients think we're wizards. We got all sorts of things going on in the back. When a patient comes in to see me and we're talking about a procedure, I immediately pull up my PowerPoint, I open it up, I show them what the procedure looks like, I show them what the gingiva looks like pulled back, I show them what the mental foramina are, I show them what a bone graft looks like, I show them all that. I go, would you like to see it? They go, no. I go, good, I'm going to show it to you. Because I am not going to be informative. I'm going to be interpretive, which is the third type of relationship. First type is paternalistic, where you're the authority figure and they listen. The second one is informative, where it's a retail relationship. You give them choices and let them choose without all the information, based upon fees and a few other things, maybe inconvenience and surgery. But interpretive is real important, where you were the doctor, you give the patient the information, and you talk about the pros, the cons, the costs, the risks, the benefits, what the prognosis is going to be. Yeah, we can give you chemotherapy. There's a small chance, a 5% chance it may extend your life by 5 years. Or there's a 50% chance that it will cure you. That's a much different conversation. Give the patient all of the information so that they can make the best decision for themselves. What it also does is it also has us sharing the responsibility with the patient, so that you and the patient become allies on the same team. And the goal is to make that patient better and to give them the best possible outcome with the less risk, the less pain, the less suffering. So if you're not doing this already, my suggestion is to make the time to be able to have that conversation with a patient. Unfortunately, a lot of doctors don't have the time to do it. They get 15 minutes, everything is in units. They don't have time to have a conversation with the patient's family, or maybe a secondary consultation. But in my experience, taking the time for those type of consultations is really important because it allows me to develop a relationship with the patient and build a relationship in a trusting environment where patients know that I care about them, and then they can make the best decision. Also, if outcomes aren't great, well, I've already told them that at the beginning. If this prognosis is not good, they know that in advance. I don't say, well, let's try to save a tooth, knowing that it has a 5% chance, without telling the patient, has a 5% chance. I don't feel comfortable doing that. If it was my tooth, I probably wouldn't do it. We could do it. Now, every now and then I get caught up in trying to save something that I know has a very poor prognosis, but if I do that, the patient is informed before. So those type of relationships, the three types, they all exist out there. Some doctors get away in some cultures, just tell the patient what to do and they listen. Not in my practice. Most people are informative, where they give them choices and the patients don't understand all the choices. And then the third type is where we have the shared responsibility, the interpretive. Oftentimes I'll say to a patient, I said, I will not participate in your treatment to make you worse, or I'll not let your ignorance of a procedure, I won't buy into that. I won't let your ignorance control it. I said, I'm going to give you the information, so now you're no longer ignorant. If you want to make a decision that's not in your best interest, now you understand it, so we can work together with that. So there's just a little bit of my spin on those three types of doctors. Tom Gawande did a nice job doing it. In future videos, we'll talk about Bob Barkley, one of my heroes who passed away, back in the 70s in a plane crash. But he talked about this. He was way ahead of his time. There's a new book that came out by Dr. Henney. That's great on Bob Barkley's life that I'll share with you in a future video. Have a great day, everybody. Remember, be the gift to you, your patients, your family, and all those around you.